All right, you guys, Ralph Havens here, Beyond Limits Physical Therapy in Bellingham, Washington, in Fairhaven. And today's session is all about some run drills and exercises. I have much more than this. I'll put links below. This is a few of the techniques, the few of the drills, the exercises we use before every single run, whether it's an easy run, a long run. We do it throughout the day. It helps to unlock the hips and the pelvis, improve your spine and the way you move, and help your running form. So if you're dealing with an injury or chronic issue, let me know, because we are at the interface of rehab, fixing up the injuries, and performance optimization, improving your running and your performance. So today's session, I'm going to show you some very, very powerful techniques. Before I do, I want to give you a little bit of an idea about this. So I've been a physical therapist for 40 years, and I'm 66 years old as of this video. I've been a runner since I was 12, and then running year-round. Between 9th and 10th grade, I was running year-round, and then ran it in Texas, and ran at Texas A&M, and then afterwards post-collegiately, and ran pretty good times. And along the way, some stuff happened. And one of the things I want to tell you about real quick is that when I was age 37, I couldn't run. I had a calf injury, and it spasmed, and I had 5 minutes of running, and then I would have to walk home. So this was going on for 8 months. I was already a physical therapist. I had the 5 physical therapists that were working for me. Different ones worked on me. I got treatment from other people. I got stretching, resting, icing, massaging, all sorts of stuff, 3 different orthotics. Nothing worked. 5 minutes of running, and I was out. I went to a therapist in Los Angeles, Julie Shishino. She does integrative manual therapy, which is what I do now. And she put her hands on me to do the assessment. It's called myofascial mapping. And she found the problem around my heart. The problem was up here. And so I had the problem in the calf that was affecting me, not letting me run. But the restriction was up here around my heart and the big heart artery, the aorta. So she did the techniques, 2 hours of treatment to unlock this. And then that freed up my leg. 2 days later, I went for a run, 30 minutes, no problem, and it never came back. So this led me down the road of learning these techniques, 116 classes in this method to date, started in February of 2000. So the key is to find out what is it your body is protecting you from. The primary root cause, it could be all sorts of things. I've seen middle schoolers that were out for the whole season, high schoolers, college kids, post-collegiates that were out for long, long periods of time, that were getting very good therapy, very good chiropractic, physical therapy, massage. Nothing was working till we found the problem. Sometimes it's in part of the pelvis, in the colon. Other times it's in the heart area. Sometimes it's in blood vessels. But the primary thing is the thing that's stopping you from running. So we can find that. Now, with that being said, that's the rehab part of it. Here's for performance, for optimization. These are some run drills that you can use. And what I encourage you to do is to test it for yourself and just walk around before, and then we do these things, and then we walk around again and retest it. Or if you want, hit pause and then on the recording, and then go for a little run, like 30 seconds, a minute, come back, do these little drills. It won't take too long, and then retest your running and walking and see for yourself what it does. So the first one, without further ado, is just to underneath your collarbone is 2 little points. Like here's your collarbone, just underneath it, you just tap it. And there's some points, they're acupuncture points, they're reflex points for the immune system. And there's some oxygen centers to help with more oxygen. And then we jump up and down. And you can do this for, 10, 20, 30 seconds or so before you run. Just jump up and down, and you tap right here. Just like this. Okay, the next one is to release your diaphragm. It's a physical therapy technique, primal release technique. It releases this. You bend to the side and you cough twice. And you bend to the side and you cough twice. The next one is something we call heel ups. It's very unique. It's from Chi running. And what you do is you think of a little groove down your leg. So a little groove down this leg and a little button in the other heel. And you lift, I'll get out here, you might hopefully still hear me. You let your foot come up, but see how my foot is really relaxed? So I don't pull my toes up, I let the foot be really loose. And this teaches your hips and knees and lower leg that when your leg is swinging, you can relax the muscles. And then you go the other side, and you just heel up. And see, I'm right here. I'm not in the front, I'm not in the back. I'm just softly letting the hip and knee unlock and softly letting the foot touch the ground. Just like that. This one we do throughout the day, numerous times a day. And if you do this, 10, 20, 30 seconds, a minute, a few times a day, 2 or 3 times a day, you do it before every run, you'll notice the difference in how you move, how you run. Now what we do with this is another technique. It's an ancient chiropractic technique, Logan Basic, and it releases ligaments in your body and joints, the ligaments, and also releases the spine. And what you do is you touch your fingers on the very top of your breastbone, so not your neck, but the very first bone, and you just touch it very lightly and very lightly push it up. But you touch it so light that if you touched any less, you wouldn't be touching. So I like to say, if you're touching a butterfly, you wouldn't bend the butterfly's knees. You don't hurt the butterfly. You touch it and then push it up. And then you take your finger, thumb and middle finger, and you flip it and you put it right behind the head. So below the head, the first part of the neck, on both sides of the neck. So below the head, first part of the neck, like this. And you super lightly touch and you super lightly push them up, but very light. And then we combine that with our heel ups. So just like this. Let's see. So you can't see me there. So we got our touch, the upper neck, the breastbone, and then little heel ups. You can barely see the legs, but you get the idea. And see how my leg is just totally relaxed. From the knee down is really limp. And I'm super lightly touching these spots. So that's a very powerful technique. Try that. And I'm going to show you one more technique to make your upper back stronger and pop your chest up and forward. And we do it like this. We start here, we go up, we turn the hands, and we put the elbows at the side. And we turn the little finger to the back. So it's like you're trying to put your fingernails on your shoulders, you're trying to put your elbows at your side, and you're trying to turn your little finger to the back wall. So this gives you much more strength in your upper back and helps pop you forward. So try that. Let's do our little tap again and jump up and down. Our little side to side. Our heel ups with our little touch. Touch the breastbone, touch the upper neck, super light. Heel ups. Okay, and then walk around and see how you feel. See if you feel a little different with your walking, and then you can test your running too. So leave a comment below. Let me know what's going on. If you're dealing with a chronic running injury, chronic problem, chronic health challenge, let me know and I can take a look and let you know what I see that's at the root cause of your condition, and you can get a plan to get your health back, to get your running back, and to enjoy life again. So my name is Ralph Havens, Beyond Limits Physical Therapy, from Bellingham, Washington, and Fairhaven, and reach out to me if you need any help. 360-599-2217, ralphhavens.com. And let's get out there and run. All right, you guys. Talk to you soon.